Et voila. Et voila.
Ah.
Right. Ta-da. Again. Hello again. Welcome back. Hello once again to part 3. Is it that way? 3? How do you do it?
I don't know.
Part 3 of 4 of the Parkrun UK event team's Q&A. So, how you doing, Tom?
I'm good. I feel like I should have changed my shirt or something to look like a different day, because we are recording this straight after the last one.
It's like the House of Games with Richard Osman, isn't it? They do like 100 episodes on the bounce in one go in a studio.
Yeah.
Well, you're good point. I should have got a new T-shirt on.
Or like PE with Joe, where there was like one different thing each time. Like I could have changed, put a different piece of music on the thing in
the background.
Well,
we can always pretend. Happy Halloween, Tom. Happy Halloween. Oh, hope you've had a spooky day today. And for the 4th one, I can say Merry Christmas to you, so we can go from there. Anyway, right. Let's get on with the questions. That's what people are watching us for. Okay, straight into this. We're rattling these out. We're doing very well today. So, clarification. Have I got that? Is it clarification? It's clarification on things. So, Southwick Country Park Run, Sean Price, co-event director. He says, please clarify who we should address issues with, ambassador or HQ?
Either doesn't really matter. You can all, any volunteer watching can contact Parkrun at any time. Contact us directly at any time. eventsupport@parkrun.com or via the website. And they can reach out to us directly. We put the ambassador program in place because we felt we started, I think, in 2013, and Parkrun was growing, and local knowledge was really, really important, and local support was really, really important, and we had this increasing number of incredible Parkrun volunteers able to do so many wonderful things, much better than we could. And so we created this volunteer network of ambassadors who have been pivotal for the success of Parkrun, and I mean, they pulled a lot of these together for this. The regional ambassadors have, and I don't think Parkrun could have survived probably without them in the UK.
Can I chip in? And I agree with you there, because it's something that I have said publicly on podcast channels for a long time. I think that they are, when you go through Parkrun history, one of the most essential cogs in the works of Parkrun and its ability to be where it is now. I mean, they're one of the most important staple points in Parkrun history. We'll look back on them going, if it wasn't for them, wouldn't be where we're at. And I wholeheartedly,
I don't think we'd have survived as an organisation. I don't think we'd still be here. I mean, they're that fundamental. And the ideal model would be roughly, and I'm going to get these numbers slightly wrong, but for every 50 events, you'd have 10 ambassadors, each supporting 5 events. And then you'd have a regional ambassador supporting those 10 ambassadors, and then the regional ambassador comes into us. And so it's a really nice process. Now, we don't always hit that. People come and go, and events start and so on. So if you'd like to go through an ambassador or regional ambassador, feel free to do that. If you want to come into directly to Parkrun HQ, you can do that. We don't have you must go in this way, you must do it that way.
Yeah, absolutely. Fair
enough. Somebody. If you're concerned and if you've got an issue, just speak to somebody. That's the most important thing.
Yeah, absolutely. I know a few ambassadors, and I'm not just saying that they're all lovely. They're fantastic. They're life enhancers. They're enhancers. That's the thing. They're volunteers. They're people who want to help and build. And I mean, some of the regional ambassadors have been around for a long, long time. I mean, their wisdom. I mean, I've gone to them for many things regarding their parkrun wisdom. So yeah, right. Next up is operations. There we go. And it's not the game where you have to get the little phone out the person on the table. I wasn't very good at that when I was little. Anyway, Andrew Lawrence says on behalf, or Andrew Lawrence emailed in. So he's, again, speaking of ambassadors here, so a lot of people put questions through their ambassador, and of course then Andrew's passed it on behalf of them. Deborah Roback, event director. On our 5-lap course, which is Highbury Fields, in our small, busy central London park surrounded by housing, how will we be able to socially distance park runners to the extent that some of our core team have stepped down until such time as a safer environment can be assured?
Thank you, Deborah. So it's always a shame when volunteers step down, core team volunteers step down. I think I would kind of try and stress to people that at no point have we said we're coming back on this date. You must come back. At the moment, we're months away from coming back. I'm sure. So. I'd try and encourage people not to stand down at the moment when there's no requirement on anybody to do anything. I totally understand and people's concerns and so on. The framework that we published was built on socially distancing where possible, but not socially distancing where it's not possible. Team sports have come back in a similar way. So we have 2 million right now. We have 2 million people registered to the FA in England playing football at grassroots level. There's I think it's 120,000 teams at 2,000 leagues, and they're all playing football all the time. And obviously they're not socially distancing all the time. They're tackling and they're sliding all over the place and pushing each other. And so if you look at the return to grassroots football guidance, for example, it says competitive match play is now allowed and people should socially distance where possible. But it doesn't mandate for social distancing at all times. Otherwise, you wouldn't be able to tackle or stand in a defensive wall or whatever it might be. And so, parkrun will only be able to come back at a time where you don't have to socially distance parkrunners at all times. Now, clearly, a busy 5-lapper, you're going to have closer contact than a quiet 1-lapper. And so there are questions there. And in a period of countdown to a reopening, some of those edge cases, and this is a bit of an edge case because it's a 5-lap course in a small busy central London park, and there's not many of them. We would have to look at those edge cases, and there might be some edge cases where we would say, actually, whilst we feel the time is right for parkrun to come back, we can't wait for all in the UK 1,200 events to be exactly right. We also can't review all 1,200 events individually before we make a decision to return. So between making a decision to return and returning, there may be a handful of events, of which this may or may not be one, but where we would say, actually, we can't get that event to the level of
mitigation, I guess.
Yeah, mitigation that we'd like to. And so that event can't reopen. Yeah. Having said that, the sign off of our framework from the deputy chief medical officers, who are both park runners, was based on an understanding. They both participated at multiple parkrun locations for multiple years, was based on an understanding of what parkrun is. And the specific line around social distancing was social distance where possible. So now I know that means something different for a 5-lapper in a busy central London park compared to a 1-lapper in a leafy rural park. But I think that has been an element of misunderstanding across all levels of people we've engaged with. Is our framework doesn't mandate social distancing at all times, nor can it, and parkrun will only come back when you don't have to at all times, as football came back on August the 1st without mandated social distancing at all times.
Did it really come back that early? Wow.
The first, yeah.
Wow. Okay, next question. Hygiene. This is the category of hygiene. A couple of questions of these. Burgess Parkrun. Chris Raveney, event director. Will supplies of hand sanitizer, gloves, laundry detergent, and any other items that could incur costs be provided by HQ?
So we've always said, and Paul's always said, delivering parkrun shouldn't cost volunteers anything. And historically, loads of times volunteers take it upon themselves to get stuff. We always ask them not to. Sometimes they do, but we do, quite firmly say we will always cover the costs of all essential things. So we will absolutely cover the costs for providing the essential stuff that we ask event teams to provide. Now, bearing in mind, we are currently not on a countdown to reopening, and the world is going to be a different place when we reopen to now. Even if we open in a couple of months, everything's changing. So right now, there is a requirement to wash bibs. That might change between now and reopening. There isn't a requirement for gloves. There is a requirement for hand sanitizer for volunteer teams, not for non-volunteers. At the point of a countdown, absolutely, we would be very clear, these are the essential items. We will cover the costs of the essential items, be that through event donations or be that through central funds. But we need to wait until we're reopening to understand what they are, because they will change over time. Also, it's important that we go through a process for that, because if we would say to event teams, just get things you think are essential and send us the bill, some people are going to be going off to Harrods and getting, perfumed hand sanitizer for 50 quid a bottle, which wouldn't be a good spend of our charity funds. So absolutely, Chris, the short answer is anything that is an essential requirement for delivering the park run as described by the park run framework at the time of reopening, we would cover all of those costs, and no volunteer should need to incur any costs for delivering park run event now or in the future. Fair
enough. And yeah, because there's always going to be people who are going to buy things and want to give anyway, but of course it's some people don't want to end up having too much to have to spend. Also, Trevor and Russell from Great Yarmouth Beach and Kay Farrow and Beverly Westwood asked the same question too. Kirsty Weston next up, co-event director at Upton House. And she says, this is quite a large question, but also asked by Simon and Natalie from Stratford-upon-Avon, David at Tees Barrage, Kirsty Weston. Well, actually, somebody's put Kirsty Weston twice. Kirsty asked twice. And then Kerry Green in Gloucester North. Speaking to core team and volunteers, the aspect of parkrun that most are not comfortable with is the finish area due to volunteers coming into close contact with multiple heavy breathing and coughing runners. Because, of course, when you finish the line, a lot of people obviously gasping and blowing out, and obviously maybe not particularly entirely lucid about their surroundings. The framework does not address aerosol transmission specifically and calls for more volunteers in the finish area, but these roles are the least COVID safe. Is HQ considering altering the framework to make the finish area safer, such as mandatory mask wearing for runners and volunteers? We feel that by adding additional COVID safety measures, volunteers would feel more comfortable carrying out these roles. Without them, we think we would struggle to get the required volunteer numbers. That's quite a very interesting question that I've seen asked in quite a few places by people.
Yep. So let's divide that into two. So one is increased risk of transmission of the virus, specifically around aerosol transmission around the finish area, and the other one is volunteers feeling safe and comforted, and whether or not they'll be willing to volunteer. So let's deal with the first one first. So interestingly, the majority of public health feedback we had was that the start line, the start area, was of more concern than the finish area. Just out of interest, I think they're both important points to look at. But when we talked to people like the Deputy CMO, the start line, because of the duration of people were there and the proximity of people, was more of a concern than the finish area, where people are there, they're more spread out. So, everybody's at the start line at the same time for a few minutes, whereas you might have first finisher 15 minutes, last finisher an hour and 15, so everybody's strung out of the finish line. At the same time, clearly people are on the start line much more calm and relaxed, and they're not breathing in the same way, and they're much more in control of what they're doing, and they've not got this kind of euphoric feeling where they're patting everybody on the back because they've just finished a park run. And clearly there's an element of requirement for volunteers to be in closer proximity to people in the finish area than the start area, because you're handing out tokens and you're encouraging people to move along the funnel and so on. We did look at every volunteer role really, really carefully, and we discussed volunteer roles with doctors that we consult with and with public health specialists and so on. I don't think there's a massive need for an increased number of volunteers in the finish area, other than people scanning. And the idea is that they will be spread out in a wider area of open space where they possibly can. And so that should create, although there's more people there should be more space. And of course, you're coming into contact with less people because there's more people scanning, so each person's scanning less people. So we looked at the scanner role and felt that by the time somebody's being scanned, they are a bit more in control of what they're doing. They're a bit less excited. They're breathing a bit less. And actually, we haven't got as far as mandating this in the framework, but actually we can scan using the virtual volunteer at a reasonable distance. And all of the public health specialists we consulted with, and not everybody agrees. So you can find a doctor who wouldn't agree with that. But all of the people we consulted with felt that wasn't a high-risk role enough for it to require extra mitigation. Now, clearly, you wouldn't put, I think it should be the person's free choice, but if I was advising my mum, let's say, if my mum was she's in her late 70s, so she's in a vulnerable category of sorts, I probably would be saying to my mum, you'd be better doing this role where there's less contact than that role. But just because there's more risk in one role than another doesn't mean there's too much risk in the more riskier role. And we looked at that very carefully, and the people we consulted with, right up again to chief medical officers, didn't feel that presented a material risk enough to require extra mitigation in scanning. Handing out tokens is the one bit where you do come into contact with a load of people, and actually you have to get within a certain distance because you have to either put the token in their hand or drop it in their hand. Again, we looked at that role really carefully and felt like actually it didn't present, it's such a fleeting contact. It doesn't have to be literally face-to-face, and I'm not saying you do it over your shoulder or something silly, but actually, and I've handed out tokens 100 times or at Part 1 events, being able to, people are coming through the funnel and you've got tokens and you're dropping a token in each person's hand, placing each person's hand, then again, we feel, and the experts we consulted with agreed, that wasn't a massively high risk area. I do think that also people will behave differently. So I think, and of course not everybody will, but I think in general, the large majority of people, pre-COVID, they might finish parkrun and they're like patting people on the back and hugging people and collapsing and making a big song and dance of it. I think we'll see much, much, much less of that, certainly in the weeks and months after we first come back, depending on when we first come back. So you have I think you will see a much more reserved atmosphere, attitude in that finish area, which can be quite hectic. We'll also be communicating a lot. We would also be communicating a lot to that effect. So I think you're going to see a much calmer finish area than you did before. We've looked at the individual roles. We don't feel they present a material, a significant risk or require mitigation. Not everybody agrees with that, of course, but the experts we spoke to, who are as senior as you get in the country, do agree with that. And we're comfortable with that position. And I don't think there's a requirement for significantly more volunteers. We have run the number. I think I said in the last Q&A, we have run the number for the number of extra scanners needed. And the majority of teams might need 1 or 2 extra people scanning, but that's it. And a couple of teams needed a load more, but actually the numbers were really compelling that I think we could get, I think a third of teams didn't need any. I think 55% of teams only needed none or one more person scanning based on the 2019 numbers. And I think with 4 or 5 extra people scanning, you had 90% of the teams covered. And remember, that's attached to the size of the event. So by definition, if you need more scanners, you've got more people to draw from. So I don't think we don't foresee that being a significant issue. Kirsty talks about mandatory mask wearing for runners and volunteers. Have we considered it? Absolutely, we considered it an awful lot. The evidence, as we interpreted it, and then the advice we had in the sign-off process with government, was that the evidence around mask wearing in that non-clinical outdoor setting isn't such that it would be appropriate, required, justifiable to mandate mask wearing for runners and volunteers in that area. Now, things can change all the time, but actually we didn't feel it was necessary, and our advisors agreed with us on that.
Fair enough.
And I do think, sorry, one last thing. I don't think teams will struggle to get required volunteer numbers at the point where we intend to reopen. We are getting really, really encouraging numbers of people saying they'd be keen to volunteer. And also, again, I think there'll be a huge drive towards stay local and volunteer, not to beat up on people who don't stay local or volunteer. That's fine too. We don't need everybody to volunteer. And in fact, we couldn't accommodate. If everybody turned up and volunteered, you'd have 1,000 volunteers stood in Bushy Park and no runners, which wouldn't really work.
Standing around clapping, nobody. Well done, nobody.
We can't accommodate that. And so, but there will be, and there's an absolute commitment from us at HQ that we will have a significant communications drive on stay local and volunteer. And I really don't think, now, definitely some volunteers will be nervous and some volunteers won't come back. And we'll we'll try and support them as much as we possibly can and encourage them and try and be creative about ways we can encourage them to come back. But I don't think in terms of volunteer numbers, there's nothing that tells us at this point in time that will be a problem.
May I ask a quick question, Tom?
Mm-hmm.
Did you notice that I disappeared just then?
No.
Wow, that is brilliant. So my internet had gone down for about a minute or two, and your answer to that question covered my internet reconnection. That's brilliant. That is fantastic.
You might have frozen, or it might have been like that psychology video where there's the gorilla running around the basketball court.
Yes,
because they're so focused on counting the people.
My head was in my hands. I was nearly crying, going, "Oh my goodness, I can't believe it!" Because you've gone right into a massive, in-depth answer, and of course, it's still recording your end. As far as I know, I hope, fingers crossed, we'll find out it's there. But and your ability to give a very detailed answer has really helped us out there. Excellent. Right, operational is the next one. Operations. Okay. Queen's Park Crew Juniors, Karen Whitehead, event director of Queen's Park Junior Parkrun and Crew. We are a new event which has gone live, but we're still waiting to start because of the pandemic. And of course, your and my hearts go out to every event team that has got so close to that start point, and then sorry, you've got to wait. It must be horrid. Netherlands, what was it? Netherlands had, what was it, 3 weeks of events, if that, before they were, Anyway, we would like to engage with young people to promote, not parkrun, and encourage physical activity, which is so important in these times where access to clubs and organised activities are restricted. We don't have our social media account yet, as we haven't held our first event in these unusual times. Could we have access to these early so that we can start engaging young people and their families? That's an interesting question. That way we can show a positive impact for the local funding we have received. Thank you. Very good question. That's a fantastic question, actually.
Yeah, it's a very good question. It's very specific, and I wouldn't like to give an answer at this point. So the reason why we don't allow, I'm not in any way saying no, I think it sounds like a really good question and a really sensible idea. The reason why we don't allow event teams to have social media prior to the event starting is inaugurals started to get really, really out of hand. And we had I don't know, you might know, Danny, I don't know what the record inaugural size is in the UK.
In the UK, something like 700 or something.
Yeah, 700 or 800 people, which is just too many. And teams just got carried away promoting before they started. Inaugurals became a thing, and then inaugurals got flooded, and it causes problems in so many different ways. So we keep them really quiet, which is why Queen's Park Crew Juniors haven't got their social media for everybody else's benefit. However, I think it's an eminently sensible idea. What I would say, Karen, and in fact, I'll make a note because you might not see this, or it's been a while since you've got the question in. I'll actually make a little note here to get in touch with you about it. Because I think it's a really sensible idea. I think if we can support it in a really good way, that'd be great. What we don't want is then 700 kids turn up to your first event in April or January or whenever it is, and it breaks Queen's Park Crew Juniors before it's even got started. So we'll drop you a line, Karen, probably before you've even seen this Q&A. Great question.
Yeah, fantastic. Thank you. Ipswich Juniors, Mark Flatman and Rory Marriott, co-event directors. If it was necessary to use the defib at an event, has parkrun considered the procedure or some mitigation that event teams need to use, given it would likely involve close contact at less than 2 meters for more than a few minutes? And that's a very good question, something that I've thought about too.
Yes, and it's somewhere where the framework could possibly be stronger. Our concern is, clearly, you don't want people not using it, applying a defib, getting a defib, treating somebody who is at a very real risk of dying, to be straight about it, for the risk of potential risk of catching coronavirus. Which there's if you're now, when you're applying a defib, you don't know whether the person is actually in a shockable heart rhythm, or they may have just collapsed or something, and the defib does all of that for you and works that out, but you don't know till you've done it and you've got close to them. I think in that situation, what we find historically from our experience in those situations, so parkrun defibs are used, and thankfully they save a lot of lives. largely without exception, when in those sort of situations, really highly skilled, qualified people are the ones, typically doctors, nurses, are the ones that actually use the defib. Now, the first few times we had situations like that, we thought, wasn't that incredible? And this is years and years and years ago. Isn't it lucky? My friend Sean, my now friend Sean, I didn't know at the time, had a massive heart attack on the start line of Huddersfield Park Run in 2013. And he had his heart attack next to two doctors, and they saved his life. And at the time, we thought, wasn't that lucky? Sean collapsed next to two doctors. Actually, as we found over the years, that has been, if not every single time, it can't be far off it, that there have been highly qualified people in delivering kind of, I don't know what you'd call it, acute life support intervention at that time there. And we have measured it, we analysed those very, very closely. We've done survey work around surveying parkrun events and saying how many people here are qualified to deliver CPR and so on, and all these things. So it's a long-winded way of answering it, but actually, in reality, what happens in these situations is somebody is in a position where it looks like they may well require a defibrillator. People get that defibrillator. All of our UK events, 5Ks and juniors, have defibrillators available and know where they are and have a plan to get it and all those kind of things. Whoever grabs the defibrillator. I was at a park run the year before last where this happened, and I saw it all happen in front of me, where a member of the event team went and got the defibrillator. And actually, every time that I'm aware of, highly trained individuals have been there at the event and have used it and know what to do, and aren't going to need advice onto how to deal with that situation in a COVID environment. At the same time, we could probably be stronger about reassuring people in the framework. In reality, I don't think, if that situation happened, and it's exceptionally rare, if that situation happened, I don't think there's much difference to what would happen normally. You've got a very real immediate threat to life right there. The type of people who typically deliver CPR and use defibrillators at parkrun events in normal times will know exactly what to do and will intervene the right way. And my understanding is they will look at what are the risks of those two situations and take action accordingly.
Yeah, absolutely. I agree with you in that latter part, especially. Absolutely. Right then, Karen Whitehead again, and this comes under notice period. Okay, so Karen's from Queen's Parkrun crew. Once events up and running again, what will be the lead-in time for new events that are live but not yet started?
So this is all the events who have had start dates or have come along in the period of closure and are now ready to go but have never hosted an event. And so, in fact, Japan closed in March with 14 events, and they're reopening now. Not all of their events are actually reopening. Most of them are. They've started another 8 in the period of closure, so they're reopening, I think, the 22, although not all 22 are actually opening on day one. So we have had loads of prospects come along. So we had loads of events pre-lockdown with a date already confirmed that's now been missed. We've also had loads of events come along during the period of closure and say, when you come back, can I start a parkrun event? Our position for those events is there'll be no pressure for them to start. So they'll be able to start the new events largely at will, which isn't something we'd necessarily afford to the events that are already started for reasons we've discussed in other Q&As. I would hope we would be able to give enough notice to everybody that would be enough for those new events to come back on week 1 if they wanted to. We've committed to capacity not being an issue there for us. So if it happens that 60 new events want to start on day 1 of Parkrun UK returning, from an organisational perspective, in terms of the capacity of supporting that, we will be able to support that. So nobody will have to then wait another 4 months in a long queue. So short answers will be up to the event teams. We'll give them enough notice so that they could start on week 1. It'll be up to the event teams. I know lots of ambassadors might have started several and would like to be at the inaugural to help each event get going, if they've supported that event. We know some event teams might want to wait a few weeks for everything to calm down. All of those things are possible. we just won't be the blocker. So events that want to get going straight away can. Categorically, they won't need to wait in a big long queue and have their start date put back another 6 months or something.
Fair enough. Okay, thank you for that. Right, this question, and this is one that I've seen. I think Parkrun UK posted your Tuesday. They posted your latest update from Tuesday, and this is something that figured a lot in the comments underneath. And now, I personally believe, I'd be interested to hear your answer. I think your answer is going to align with my feelings on this. But Rick Adams, and he's an event support ambassador, says, given that the number of volunteers will need to be increased and at some of my events considerably to account for additional barcode scanners, etc., would it not make sense to remove the timing aspect and give all participants a time of 59:59? Removing finishing times would free up the timekeepers who could then scan. I think most people are more concerned about receiving a run credit than a time.
So it's a really sensible question, Rick. It's come up an awful lot of times. I think, so I don't know which your specific events are. You say some of your events need to have considerably more volunteers to account for additional barcode scanners. Now, I know some events needed 8 or 9 more people scanning. They are the larger events, so it shouldn't be difficult. We don't think it'd be difficult for them to get it. There were a couple of outliers. I mean, literally two probably out of over 1,000 events that needed, I think one needed another 20 scanners and one needed another 12 or something. But those are incredibly rare, and they are by definition very big events with a large pool of people to draw from. So I'm happy to have that conversation around what are those specific events and what are those specific requirements, and do we really need considerably more scanners, and would that be a problem? In general, that's definitely not the case in general. I think the freeing up people timekeeping, at most you're freeing up 2 people. Lots of events might only have 1 person timing, so you're freeing up 1 person. So I don't think it makes that much of a difference having 1 or two more people. And I think a huge number of people are really interested in the time of their run. Now, sorry for that, it was a beeping at my end. I think a large number of people, the majority, are concerned about their time. Now, if you would say you can come back with 59:59 or you could not come back at all, I'm sure people would rather come back with no time than not come back at all. But actually, I think if you said, do you want to come back with a time or without times, I think overwhelmingly people would want to come back with times. And I don't think that, if a large team, a really large team that typically didn't have many people scanning previously, needed 8 more people scanning, let's say, and the very few teams fall into that category, let's say they needed 8 more people scanning, then freeing up 1 or 2 people from timing doesn't really make a material difference to the overall volunteer requirement in that sense. We'd still need to give out tokens, we'd still need to record people, we'd still need to scan at the end. But so you're only removing a tiny part of the process.
Fair enough. Cool. Right, last question for this particular section, part 3 or 4, and this comes from Basin Soap Juniors at Parkrun. I'm reading the email address. Paul Fielding, who's event director. Uber tourist Paul Fielding. It's like something out of Anchorman, isn't it? I've read the question mark at the end of the sentence. I'm Ron Burgundy. Anyway, our marshals' lanyards have whistles attached. These would be difficult to sanitize. Should we remove them? And Catherine Penketh from Harlow Juniors asked the very same question.
Yes, so really good question. I think I think we might have addressed this in the last one Q&A, but the washing stuff is something we wanted initially to quarantine equipment. So you'd put lanyards and bibs and things in whistles into something, leave it, get it out on the Friday, tidy it up, use it on the Saturday. And that period from the Saturday or the Sunday if it was juniors to the Friday or the Saturday, 6 or 7 days, whatever it is, 6 days, would be enough to quarantine it. Now, at the point we were getting sign-off from government for the framework, the requirement for us from them directly, we were pushed back. It was pushed back on quarantining equipment, and it was requested that it be washed at that time. that is something that we were still, however, so we accepted that at the time, and that allowed us to publish the framework, and that may have been the way we went forwards. And the countries now where we're seeing parkrun happening, they are doing that. So in Australia, in New Zealand, Falkland Islands, they are doing that because that's what's in the framework. At the same time, that was a live discussion during the September and would have been October through that process, and we would have liked to have got it approved that we could quarantine equipment rather than wash it, which would fix that problem. At the same time, I don't know how difficult it is. Soapy water is the thing. So washing a lanyard with soapy water or dipping a whistle in soapy water, I think probably would be sufficient. But we could look at the detail nearer the time when it was more imminent. Personally, I've never been a big fan of whistles, and I'm not. I know lots of people in the staff team think they're really important things, and loads of event teams use them, and that's fine. So if event teams want to use whistles, they're welcome to. I think removing them wouldn't be a problem, and I don't. I sit in the middle of all of our incidents that we record and review, and we look at everything every single week in normal parkrun time. This is what happened, and so I have a pretty good understanding of the incidents that happen at parkrun, be it lost children or people falling over, or we talked about defibrillators earlier. And actually, it's very rare that I can't think of a single example where I've seen a whistle make a material difference to the management of an incident and get somebody support quicker or get attention better and so on. Doesn't mean it doesn't happen. No. We allow them, but I think if you were not sure, I'd say ditch the whistle.
Yeah, and definitely do not share them. Definitely don't share them around. That's one thing we could definitely say, do not do. Yeah, fair enough. Well, thank you very much. Right, and that's the last question for this particular round. There you go.
Thank you very much, Danny.
Right, excellent. I will, as always, find the thank you for watching little button and say thank you for watching, everybody. Thank you for your time once again, Tom. And I will see you in some time, Tom, for the next round. See you in the future. Bye. Anyway, thanks. Bye-bye for now. See you shortly. Anyway, right, take care, everybody. Bye-bye.